So here is the adverse extracardiac effect on antiarrhythmic drugs. Severe extracardiac effects are also common with the antiarrhythmics. This tends to be drug specific. First would be the drugs under the class I drugs or the sodium channel blockers. It has three subclasses. First, the class IA. Under this, we have quinidine and procainamide. Quinidine associated with kinkunism, a syndrome characterized by nausea, vomiting, diarrhea, and a variety of sinus effects, like tinnitus, headache, auditory and visual disturbances, and vertigo. Hypotension, and also it can cause elevated serum digoxin concentrations, hypersensitivity reactions like rashes, fever, agoneurotic edema, hepatitis, and reversible thrombocytopenia. While procainamide has an adverse effect like hypotension, lupus-like syndrome, gastrointestinal symptoms, adverse CNS effect, hypersensitivity, reactions like fever, and agranulocytosis, and it can lead into fatal infections. Next subclass would be class IB drugs. Under this, we have lidocaine and phenytoin. Lidocaine has a CNS effect, like CNS depression or CNS stimulation, while phenytoin has a neurological effects like drowsiness, ataxia, vertigo, nausea, and nystagmus. Next subclass would be the class IC drugs. It has inkinide and flecainide. It has neurological effects, about 10 to 15% with flecainide, and it may result into dizziness, tremor, agitation, headache, visual disturbances, and gastrointestinal upset. Next would be the class 2 drugs or the beta blockers. It has an adverse effect like bronchospasm. It occurs when the airways of the bronchial tubes goes into spasm and contract. This makes it hard to breathe and can cause wheezing. A sudden withdrawal can precipitate angina, a cardiac arrhythmia, or myocardial infarction. Acebutolol associated with arthritis, myalgia, arthalgia, lupus-like syndrome, and pulmonary complications. Next is the class 3 drugs or the potassium channel blockers. Under these, we have amiodarone and beryllium. Amiodarone has an adverse effect like pulmonary toxicity and fibrosis, hepatic dysfunction. Asymptomatic corneal deposits occur in all patients. It has many CNS symptoms, hypothyroidism and hyperthyroidism, cutaneous photosensitivity, and blue-gray discoloration of skin, peripheral neuropathy, and also it enhances the effect of warfarin and increases the serum concentration of digoxin, quinidine, procainamide, and other drugs. While beryllium has an adverse effect like hypotension and increased sensitivity to catecholamine. Then the class 4 drugs or the calcium channel blockers. It has verapamil and diltiazem. Verapamil has an adverse effect like hypotension, dizziness, headache, fatigue, peripheral edema, gastrointestinal effects, and can increase serum concentration of digoxin and may interact with many other drugs. Then diltiazem. It has an adverse effect of hypotension but fewer gastrointestinal effects than verapamil. The last would be the other agent. Under this, we have digoxin and adenosine. Digoxin has many adverse side effects like anorexia, nausea, vomiting, diarrhea, abdominal pain, headache, confusion, and abnormal vision, while adenosine has hypotension, flushing, transient dyspnea, chest discomfort, and metallic taste.